Hello, my name is Jordan Burklund, and I am with All Smiles Community Oral Health, and I'm here to present to you Healthy Habits for Healthy Smile, which this presentation is geared towards educational staff. Like I said, my name is Jordan Burklund. I use she, her pronouns. I am an expanded practice dental hygienist with All Smiles Community Oral Health. I'm also their community education specialist, providing these types of presentations. I started working with All Smiles back in June of 2022. And prior to that, I worked at a few different public health clinics. So I have many years of public health experience. For today's presentation, we're going to go over a few things. First off, I'm going to answer some frequently asked questions we've gotten about teeth. I want to also give you an overview of basic dental issues, particularly ones that we are looking for when we do our screenings. I want to just give you some information about like what we're looking for and also kind of provide to you some examples so that if you were to see something going on with a child with their teeth or their gums, I want to give you the confidence to be able to kind of talk to the parents about getting them in to see a dentist. Um, I also want to talk about our workflow when it comes to Head Start screenings from start to finish, kind of explain what we do, what we need from you, how we can work together. And I also want to talk about care coordination, which is a very important part of our organization and what we do. And lastly, I want to give you information that you can use to educate families for making sure that they have good dental care at home. So for the dental basics, I want to provide a disclaimer that I will be showing multiple pictures of things like cavities and abscesses or infections. So these aren't going to be very pretty pictures, but I think it's very, very important that we see examples of what issues can look like. Because again, I want you to be able to, if the child is complaining about something or if you see something kind of off, I want you to feel like you can say something and know that, oh, I've seen this picture something like this before. I think there's an abscess going on, and give you that confidence to talk to the parent and say, hey, I think you need to take them into the dentist or what have you. Excuse me. So the first question, one that we get very often is, why are baby teeth important? So baby teeth, while they will fall out eventually, they do play a very important role in a child's development for multiple reasons. One is with eating. If you have tooth issues or you're missing certain teeth, it can be very hard to, eat, to chew. So they play an important role with eating, as well as with speech development. So we use our teeth to make certain sounds. So if you lose teeth too early, it can affect speech development for the kids. Another thing is it impacts their positive self-image. If they have broken teeth, chipped teeth, discolored teeth, missing teeth, it can really affect them, which can cause them to have issues when it comes to going to school, interacting with other kids, with adults, with anybody. So it can affect their image. And lastly on my list is they are placeholders for permanent teeth. So if you lose teeth a little too early for the baby teeth, then it might mean that when the adult teeth come in, they come in crooked, meaning the child will need braces eventually, which can be a very, very expensive cost, and take a lot of time and effort. So these are all of some of many reasons why baby teeth are very important. So another question we get is, when do the teeth come in? So, and how many teeth are there? So baby teeth, there are 20 baby teeth, and you'll hear me counting that often with kids. And they tend to start coming in around at 6 months of age. And they'll keep getting more and more teeth in until they're about 2 or 3. And these numbers are very generalized. It could be way earlier than 6 months, way later than 6 months. Typically, there's nothing to really worry about. If parents are concerned that teeth aren't coming in, they can always go to the dentist and ask questions. But this is just a basic guideline of when teeth come in. And then as they get older, till when they're about 6 years old, give or take, that's when their baby teeth start falling out. And they'll keep falling out and growing their adult teeth until they're about 11 or 12 years old. So one of the things that we look for when we're doing our screenings, we are looking for cavities, or otherwise known as caries. With those two words mean the same thing, dental professionals usually say caries. So if you hear me saying one or the other, just know that they mean the same thing. So a cavity is basically when a tooth breaks down, and it does so because there are bacteria in the mouth that can cause cavities. And if they eat sugar in the foods that we eat, they'll eat that, create acid, and that acid will eat away at the tooth and cause that breakdown. So if you have bacteria, sugar, and a tooth, that is the perfect uh, recipe for cavities. And cavities can look very different depending on where they're at, how far along they are, so many factors. So they can look brown, they can look white, they can look black. They may or may not be painful for the child. But one thing to kind of keep an ear out for is if there's pain with certain foods, like if when they eat sweets, if their tooth hurts, or if they drink something cold and their tooth hurts, those could be signs of a cavity. Excuse me. And we have various photos of different cavities, and I've seen all these kinds of cavities. As you can see, some are yellowish brown, some are black, some are much bigger, some have taken over most of the tooth, so most of the tooth is broken away. Any of these could be painful or may not be painful to the child. So what can happen if you don't treat the cavity for a while? You can get an abscess, which is an infection in the gums that came from the tooth. So what happens is you get a buildup of pus and blood in the tissue around the tooth, and it can lead to like a bump on the gums that looks kind of like a pimple. It could be white, yellow, or reddish. Um, and in extreme cases, it can cause facial swelling, which is another thing to kind of be aware of if you see one of your kids in the classroom with like one side more swollen than the other. That could be the sign of a very serious abscess and needs to be treated immediately. So they would need urgent medical attention and usually get antibiotics when they go to urgent care or the emergency room. And I'm going to be showing you pictures of various abscesses next. So as you can see, they can look very different. Um, and I will move my little screen so you can see up here. It can be white, it could be yellowish, it could be reddish, it can lead to extreme and not so extreme facial swelling. So definitely keep an eye out if you see one side more swollen than the other. So when we find cavities and abscesses, what do we do? Well, we have various treatments available, and I'll quickly go over those. And another thing that we want to do is we want to prevent these from even happening. So, talking about prevention strategies, the biggest way to prevent cavities is fluoride. So, fluoride is a natural mineral, therefore, it can occur naturally in water. A lot of times, you find it in well water. It's something that the CDC has recommended and has been putting in water, community water areas since 1945. Um, and it just helps strengthen the teeth and helps protect them from cavities. But even though it is something that we put in the water, only about 22% of Oregon's community water is fluoridated. And a not so fun fact is that Portland, Oregon is the largest US city without community fluoridation. Um, so what that means is we need to get fluoride other ways. One common way is through our toothpaste, but a lot of times the toothpaste doesn't have very strong fluoride in it. So we need other ways to bolster our fluoride intake. And another way is a lot of times doctors will prescribe drops for infants or tablets for the older children. Another way to get fluoride is by way of us by providing fluoride varnish, which is where we paint it onto the teeth. You can get it from us when we come into the classroom, dental offices during their exams. Sometimes even doctors will provide it. So the only thing to be aware of is we would like ideally at least 6 weeks in between applications because you don't want to over fluoridate the teeth at any one time. But ideally, you'd want to get fluoride 4 times a year. every 3 months or so. So if you know that one of your children has gone to the dentist and has gotten fluoride, that is really good information for me to know. And if it's been very recent, then I may decide not to place fluoride on their teeth. So that's some good, just good information to share as you hear it. Another way to prevent is from sealants, which is just a way of kind of um, covering some of the grooves of the back teeth that tend to get cavities. It's something that we've been doing for 50 years or over 50 years, prevents most of the cavities in the back teeth. And that's something else that we do at All Smiles in a lot of the Tri-County elementary and middle schools, as well as other clinics will do it too. So when it comes to treatment, silver diamine fluoride, or SDF, is incredibly amazing. It's not technically a full treatment because you're not getting rid of the cavity. However, it's so helpful because what it does is it kills the bacteria that causes the cavities and it stops the cavities from developing further. It's a liquid medication that you paint onto the teeth. The only caveat, the issue that a lot of people come across is that any part of the tooth that is a cavity will permanently stain black. And that turns a lot of parents off from getting this really, really important treatment. So it's something that I like to just tell everybody about because I want to remove the stigma of SDF. A lot of people, a lot of parents get nervous about getting this because they're afraid people are going to judge the kids. The kids will get bullied. People will think they're bad parents because the kids have black teeth, but it is in its way, it's actually an amazing thing because it can stave off more significant, possibly traumatic treatment. So, and it's often used on baby teeth, which will fall out. So they won't have these black teeth forever. But it's great if they can get the SDF treatment instead of having to go through getting fillings or crowns or extractions. So this is amazing stuff, and I love telling everybody about it. But when it is more extreme and you have to take care of the teeth in a different way, there's other treatments. There's fillings, either silver or tooth colored. Um, there's stainless steel crowns. As you can see, a lot of kids have these metal crowns, or in more significant cases, they extract the teeth. So now is the time to talk about what we at All Smiles do for Head Starts and pre-K classrooms. So this is kind of an overview of our kind of workflow. What we do, like what I would do, is I would confirm the time and location with the site contact or the person I am working with that day. And then when we get to the site, depending on the organization I'm with, we'll go over the consent forms, either electronically or before we go into the classroom or while we're in the classroom. Again, it depends on what organization I'm with that day. Then we set up the clinical area, oftentimes in the classroom, sometimes not. And as we get each student, we confirm the student identity and what services they can have, if they're signed up for screening and if they're signed up for getting fluoride. Then we do the screening itself. I tell my information to the person I'm working with. They chart it. We provide fluoride. We fill out a results form to provide to you at the end. And then afterwards, I do any referrals that need to be done. So as far as getting the classroom ready for me and the other hygienists I work with, one thing is for consent forms. If they're stored on site, again, sometimes they're with the person I'm working with, the contact. Other times they are stored in the classrooms. So if that's the case for you, it's important to have the most recent forms, in case the parents have updated what they're okay with or not okay with having. It's important to have the most updated form with you. And if you do have them in your binders or in some stored in some way, having them alphabetized just makes it a little bit more streamlined when it comes to confirming everything. It just makes the whole process a little bit quicker. And then if we are screening in the classroom, it's good to kind of just make sure we have like a table we can use so we can do the chart notes, and having a couple of chairs for me and whoever is with me screening and charting for me. and getting the kids prepared is really important. One thing is making sure the kids have some kind of name tag, whether it's like a pre-made name tag or painter's tape with their name on their back. Something, anything that can just help me identify who the student is. And that helps because I can quickly do it. And I don't have to like waste anybody's time by like trying to get a hold of, a staff member to confirm this identity and just double check. So having name tags is really helpful. And then another thing you can do prior to me coming into the classroom is just to prep the students with like what it is that I'm going to be doing. I've noticed that when the teachers are able to do that, the kids tend to be way more compliant and things are more streamlined and it's just a little bit quicker and I'm in and out a little bit faster for you guys. So I'm not disrupting the class as much. So that could be just telling them I'm going to be checking their teeth or I'm going to be counting their teeth. And I'll show you a picture of some of the stuff that I use. And then I'll also be providing fluoride or giving them a vitamin to help their teeth be stronger. So this is what my screening setup typically looks like. Um, I have my gloves and my mask. And I have my hand sanitizer that I'm going to be using between every kid. And then I use a mirror and I use this bright flashlight to check their teeth. And then after that, I use my fluoride varnish, which is just a little paintbrush and a little bit of like kind of liquid, almost like toothpaste varnish that I paint on their teeth. And that's it. And then we fill out the results form. So this is a score of 0 to 2, which is a basic screening survey. It's just a basic assessment tool. And so if you hear me say there is 0, that means I haven't seen any issues. If there are 1, that means I see cavities. And that basically means they'll need treatment eventually. And it's good to encourage the parents to make an appointment with a dentist. If I say there's a 1 plus, that's not on the form, but that's kind of for me and whoever I'm with to know that we're going to need to put in a referral to the care coordinator. And that typically means that there's like either a very large cavity or there's many, many, many cavities. But there's no sign of an abscess or there's no pain yet. So it's something that needs treatment pretty soon, within the month. If the patient is a 2, that means there is either pain or an abscess present, and that needs immediate treatment within the next 24 to 48 hours. So when it's a 1 plus or a 2, then what I would do when I get home is I would input them as referrals. We also have an ad hoc referral that I'll explain in just a second. But I will input the referral by the end of day, and then the care coordinators at our office will input that referral into their system within 48 business hours. And within the next 2 weeks, they will follow up on scheduling. If the dental office, if a dental office has contacted the patient's family, if there's something scheduled, they'll check in on that. And if for some reason we haven't been able to reach the parent or guardian, our care coordinator will send a letter. The dental care organization that they're with through their insurance will also send a letter. If we don't have an address on file, we do reach out to the school. So that's kind of our basic process. There are also ad hoc referrals, meaning a referral that doesn't necessarily have to do with cavities. It could be the family contacts us because they're looking for help finding a dental home. It could be, say, I'm seeing a child and there may be like some sort of growth or some sort of just something not looking right, like some kind of spot in their mouth or a sore in their mouth that I want to get checked out by a dentist. Or it could be the patient has been absent like the last 3 times, and I want to just make sure that they have a dental home. So I might put in a referral for our care coordinator to reach out directly to the family and check in on that. Now, you guys can also send in referrals. We do need permission from the parent or guardian to look up their information and call them. So we do have this dental care coordination consent for dental care form on our website under our resources and forms tab. So as long as you are able to print that out, give it to the parent to fill out, then you can send it to us, and that will give us permission to reach out to the family. So if there's something you see, or you have some kind of concern, or the parent has a concern and they've voiced it to you, you can put in a referral this way. So now I want to talk about just basic education, information that you can impart on the families as far as taking care of their kids' teeth at home. So we can help prevent dental decay, dental cavities at home through talking to them about nutrition, talking to families about feeding behaviors, um, talking about the importance of just maintaining good oral hygiene and using good preventive agents like fluoride. So I've broken this down into a couple of age groups. So for babies, it's important that parents and guardians get into the routine of wiping down the baby's gums twice a day with a soft, clean cloth. Typically, it's best to get into the habit of doing it after the first feeding of the day and after the last feeding of the day. And once the baby teeth come in, start brushing them. Definitely start getting into that habit of doing it twice a day. We want to get into the habit earlier than later. Um, and as far as another question that we get is, when do kids go into their first appointment? And it's usually around when the kid is 6 months old or when their first tooth comes in, whichever happens first. That's ideally when kids should be seen by the dentist, because we want to get the kids into the dentist and used to the dental office before there's an issue that arises. And we want them to feel safe and taken care of. And it's also a good opportunity for the parents to get any questions answered. However, I do understand that there is a shortage of dentists and dental hygienists out there. So a lot of times there is a longer wait. But this is kind of the standard, the guideline of when to see the dentist. And another big thing is, don't let the baby fall asleep with a bottle, because that can cause a lot of cavities, especially in those front teeth. If babies fall asleep with like milk without having their teeth brushed, just having that milk sit in there is just a recipe for a lot of cavities. And then when they start growing up, you want to again reinforce brushing twice a day with fluoridated toothpaste. It's important that the parents and guardians help their kids brush their teeth until they can do it themselves, which is like around 6 years old, give or take, depending on the kid. But definitely like continue monitoring the kid until the parents are sure that they have good brushing habits. Kids take a little bit longer than people might think to get into that habit of brushing their teeth really well. And it's good to introduce flossing before bedtime. And again, make sure the child doesn't eat or drink anything between brushing their teeth and going to bed, besides water. Because we don't want anything with that sugar, those carbs sitting on the teeth while they're sleeping, because it's really easy to get a lot of cavities that way. So we have this handy dandy like flyer that you can get on our website, and this I've broken down on here um, as like a little way of helping families troubleshoot if their child hates brushing. So we have some tips that we've come up with. One is to find a song online. There's a lot of toothbrushing songs, videos on YouTube. Those tend to help kids kind of concentrate on getting making it fun. It's important to kind of just set up a routine. So I always say, like, yeah, if you change into pajamas, like, or if you go to the bathroom before you go to bed, brush your teeth too. Kind of just tacking it onto an already existing routine. Um, Sometimes it's just the toothpaste itself that the kids don't like. So a lot of times mint is too spicy for kids. So trying out like a fruity or bubblegum type flavor can help with making brushing a little bit easier for kids, and also using the right amount of toothpaste. A lot of kids do use too much toothpaste, and that could be a sensory overload and make it so they don't like brushing their teeth. So if a child is under 3, a good rule of thumb is to use a size of rice amount of toothpaste. For kids 3 and up, about the size of a pea. And then there's other ways like using stickers or some kind of like reward to check off each day that you brush your teeth. Um, and just making it a whole family thing of just like making sure a parent or guardian is brushing their teeth with the kid. That can help them kind of get into that habit of brushing their teeth. Okay, we are on our final leg of the journey. This is just a couple of resources that I have. So first off, again, our website has awesome resources. We have these awesome brushing guides, and on the back side is flossing guides. We have that in English and Spanish. We also have this booklet as well that might be helpful to read to the kids about just what it looks like to have a dental checkup. I think this is more geared towards doing sealants versus fluoride varnish and Head Start screenings, but it's still a good way to kind of ease the fear that kids might have of having a hygienist come into the classroom. So you can also request that book from us, but there's also PDFs of it on our website. And another great resource that we have is we have this little Find a Dentist page on our website. So if you have families coming in saying that they're struggling to find a dentist, you can always point them to our website or our phone number. But this is a good place to start if they want to kind of see um, where they can go for their teeth. We also have a few other partners that we work with. So if they're looking for a clinic, but they don't have, insurance or something, they can always check out Virginia Garcia or Neighborhood Health Center, Multnomah County, Clackamas County. They're just other public health clinics that do a lot of what we do and help people find insurance or find providers for them. If you have, say, a parent coming in and they mention themselves having dental issues, you can always point them towards Medical Teams International. This is a dental van, mobile dental clinic that serves adults only, but they provide care for like urgent dental procedures. If somebody's having a lot of dental pain, bleeding, swelling, they can always use Medical Teams International to get their teeth taken care of in that way. And then lastly, I just have a couple of resource ideas, some just pages that can be printed out for free, just to help families, again, get into that routine of taking care of their kids' teeth at night, um, and at home, at the dentist, just the importance of taking care of their teeth and having setting up some good routines. So we've reached the end of our presentation. And so we talked about teeth, we talked about cavities and abscesses, oral health education, our Head Start screenings, what we do it for All Smiles, and I provided a few resources for you as well. And I also have this last slide with my contact information. You have my email, you have the email address for our care coordination team if you have referral questions, um, our website link, as well as our office phone number. And just the last couple slides are just sources that I have in case you wanted to know where I got some of my information from. But thank you so much for listening to this presentation. I hope you've learned something and yeah, thank you so much.